Good evening, class.
Good evening, sir.
Good evening, Prof, and welcome, sir. Welcome
How
to
are you today? I hope you are ready for the lecture today.
Yes,
and
we
that your
do.
network is strong. It will not be logging you out. So pray that my own also is strong. It shouldn't log me out. Can you see my screen?
Yes,
Yes,
Prof.
sir.
Yes, sir, we can see your screen.
Yeah, you can see your
All
screen,
right.
sir.
All right. Today we want to look at medical products, vaccines, and technologies. It is one of the building blocks of any health system. When you are sick, they will ask you, have you gone to the hospital? Have you taken drugs? If there's a disease outbreak, people will ask, have you taken the vaccine they are taking? So, what does that mean? It means that medical products, vaccines, and other technologies are very vital in the provision of healthcare services. In fact, it is one of the building blocks of the World Health Organization health system strengthening strategies. So today we want to take a look at that. It will not be as detailed as it should, but let us look at the outline. Introduction, look at medical product, vaccines, and technology. We'll look at appropriate technology for healthcare services. Then we'll look at essential drugs. And then cold chain management. And then medicalization of food. So let's start. We have been told what a health system is, and that it is all the organization, people, and actions that are carried out to provide promotive healthcare, restore health that has deviated from normal, and maintain the health of members of individuals and members of community. And that is done, the health system functions through the performance of healthcare workers and other stakeholders. So the performance of any health system is determined by several factors. Besides those directly clinical services, there are those that are outside. And like I said before, the World Health Organization, the building blocks for any health system by the World Health Organization are 6. Service delivery, that's provision of services. And the services are to be provided by health workers. And they're going to use health information for decision making. And they will require medical products, vaccines, and technologies to provide the services. And they also require finance to provide the services, particularly procurement of medical products, vaccines, and technologies. And then the health system will function well when there is good leadership and governance to provide regulatory guidelines and oversight. So in a strong health system, all the building blocks work together so that timely, affordable, and high quality healthcare services can be provided to individuals whenever and wherever they need them. However, where one or more of the blocks, the building blocks, is weak, the system cannot function well. It will falter. Any questions, class? This you already know. So let us look at the first scope item, medical product, vaccines, and technology. Now, the medical product, vaccines, and the technology we apply are part of the pharmaceutical system. And the pharmaceutical system functions to ensure equitable access to an appropriate use of medical products, vaccines, and health technologies, which is a core function of any health system. So the components of system that fulfill this function together constitute the pharmaceutical system. In other words, the medical products, vaccines, and technology, which is a key component of the 6 building blocks. So it fulfills the function together. And what does it do? It includes all structures, people, resources, and processes that interact with the broader health system. In other words, this interacts with service delivery, it interacts with health workforce, it interacts with health information management, and so on and so forth, financing. So what is the role of the pharmaceutical system in healthcare delivery? It aims to ensure equitable and timely access to safe, effective, and quality products and related services. And these services or products are needed to promote the appropriate and cost-effective use of these products to improve health outcomes. So, what is the framework for the pharmaceutical management system? It talks about selection of the required medical products, vaccines, and then procuring them from wherever they can get access to. And then after procurement, you store and distribute to the facilities or the units. And at the units, they are put into use. They are put into use. And this function, the pharmaceutical management system, is supported by the core management support functions like organization, financing, information management, and human resource management. Any questions, class?
No,
So,
sir.
For us, equitable access to health products is a global priority. And when such products are available, they are accessible, acceptable, as well as affordable, it assures of healthcare of good quality. So addressing access to health products will invariably enable the health system to achieve Sustainable Development Goal 381, which is coverage of essential healthcare services. Because if you go to the hospital, you are seen and you are not given drugs, then you have to go look somewhere looking for it. And if you go, you might buy it costly. You might even buy substandard drugs. So every disease management strategy requires access to health products so that if need be, we can prevent. We can make a diagnosis. In other words, all the laboratory reagents are part of medical products, then treatment, the drugs, palliative care, and rehabilitative care. So providing access to healthcare services, particularly medical products, is a global concern, given the high prices of drugs today and the rapidly changing market for health products that puts undue pressure on health systems' ability to make products available and accessible so that they can provide high quality healthcare services. So most low and middle income countries spend a high amount of money on procuring medical products and services, and indeed accessing healthcare. And such high expenditure impedes progress in many countries that have committed to the attainment of universal health coverage. So a large proportion of people in low-income countries pay for healthcare services out of their pocket. particularly for drugs. Because even when they say healthcare is free, sometimes when you go, you might not pay for consultation, but they say the drugs are not there. Even people who are covered by social health insurance, sometimes when they go to the hospital, some of the prescribed drugs are not available. They still have to go and buy, and that will be out of pocket. So, with the epidemiological transition in most low and middle income countries, where we are transiting from high communicable diseases to non-communicable diseases, many of the chronic NCDs require long-term treatment. And that means that they will place a large financial burden on families. They will place a large financial burden on governments. And this burden will increase with passage of time. So how do we improve access to health products? It is a multidimensional challenge that requires policies and strategies that are broadly identified and tackled. So, what are these policies? How should these policies and strategies be? Whatever policies and strategies, be they comprehensive, should align with public health needs, with economic and social development objectives. And it should talk about collaboration with different sectors and partners. So such policies also need to be aligned with legal and regulatory framework and cover the entire product cycle. That's part of leadership and governance, from research, development to quality assurance, as well as supply chain management and utilization. So if there is no question on medical products, vaccines, and technology, let us go to another scope item: use of appropriate technology for healthcare services. In the Alma Ata Declaration for Health for All by Africa, which was the basis of primary health care, appropriate technology was incorporated in the definition of primary health. That the healthcare services should use appropriate technology that can be afforded by individuals and communities from time to time. So what is appropriate technology? Appropriate is an English word, something that is right. So appropriate technology refers to any technology that is designed to be suitable for the context it is intended for. And that has to take into consideration environmental, cultural, political, and social as well as economic factors. In other words, does our environment sustain the use of this technology? Does our culture accept it? Is the political environment suitable for the use of such technology? And do we have the finances to acquire the technology and operate it? Do we have the skills, the people who can maintain it? Anything that is culturally unacceptable, it's not suitable for that environment, it's not what people can, organizations can afford, then it's not appropriate. So appropriate technology emphasizes small scale, affordable, labor intensive, energy efficient, and environmentally sustainable solutions. And these solutions must utilize local resources, must utilize the available skills of the people. In other words, we should not employ a technology that will require us bringing expatriates from somewhere to come and operate for us, particularly in developing countries. Because when you bring expatriates, you have to pay them in foreign currency. Or you pay them much higher so that when they convert it to foreign currency, it will make some sense in the place they came from. So, what is the origin of the concept of appropriate technology? It originated from Ernst Frederick, an economist, who advocated technologies that are accessible and beneficial to local communities. So, appropriate technology is generally defined as any tool, system, method, object, process, idea, or practices that are scientifically valid. And that's why scientifically sound is part of the phrase scientifically sound is part of the primary care definition, and enhances human fulfillment by satisfying human needs while being compatible with local, cultural, and economic conditions. So what does appropriate technology need to function? It utilizes locally available materials and energy resources. And that is done with the aim of being self-reliant or self-sustaining. And also ensures that there is no cultural disruption in the adoption of such technology, ensuring relevance to the welfare of the local population. So appropriate technologies are those that are affordable, and they also ensure that there is equitable access to healthcare services that are provided through them. So the appropriate technology concept emerged as a response to the challenges that are posed by conventional technological transfer, particularly from industrialized to developing countries. So appropriate technology emphasizes the need for technologies that are not only effective, but also accessible and sustainable. Some years ago, we were trying to establish a specialist cell facility in the Navy. So we went around the country, went to UCH, went to National Hospital Abuja, and we realized that most of the CT scan machines were not working. They were not working at UCH, at National Hospital Abuja. They said those machines require electricity all the time. The machine cannot be switched off for even a short while. Meaning that the environment we find ourselves where we are not sure of continuous electricity, we cannot use such machines. And for you to use it, you have to put it on and charge it for so many hours. So that is the problem. We needed them, but our environment was not suitable for it. And we cannot be running generator just because of one machine. So that is the problem. We have a lot of machines, equipment in the country, that once they break down, we can't maintain them. We have to look for the suppliers to come. Even when we put maintenance clauses in the procurement agreement, by the time we use it for 3 years, they have changed the machine to a newer model. So we run into trouble because we did not acquire a technology that was appropriate. Any questions, class?
Yes, bro.
Now, this CT scan I'm
Yes,
talking
it's
about,
true.
In Nigeria, those machines are only in tertiary health facilities. But abroad, at the primary level, they refer people to go for CT scan. At the primary healthcare level, they send people to go for CT scan. While CT scan at a time in Nigeria was about 80, 90,000. In India, it was the equivalent of about 7, 10,000 naira. So that was it. First and foremost, it was beyond the reach of the common person in Nigeria. If it's not made free, most people cannot use it. But if in India it was the equivalent of 7, 10,000 naira, it means that almost everybody here can use it if a technology is available and the economies are similar. So what are the key principles of appropriate technology for health? One is that we have to utilize resources that are locally available. Local resource utilization. It encourages the use of local materials and local human skills so that the use can be sustainable. And if you are paying in local currency, you are using local people, the cost will be less. If we are using the technology in Abuja and we have to bring a maintenance personnel from Sokoto, the cost of that movement from Sokoto to Abuja, stay at Abuja, will be added to the cost of effecting that repair. The same thing, getting somebody from Maiduguri to come and service an equipment that went bad in Mina. The cost of transportation, cost of stay. But if people within that environment can service it, then it will be sustainable, to be cost effective. So this approach reduces dependence on imported technologies and promotes self-reliance within communities. The second key principle is simplicity and sustainability. Appropriate technology should not be complex. It has to be as simple as possible so that it can be easily understood. Technology should be simple to use and maintain. This ensures that communities can manage them without extensive external support. The simplicity often leads to low environmental impact and promotes sustainable practice. The next key principle is cultural and social compatibility. Any technology that is culturally unacceptable, socially incompatible, cannot work because they will reject it. So such technologies must align with the cultural values and the social structures of the community within which they are being brought to serve. If that technology is culturally and socially compatible, then it will enhance acceptance and use, and it will ensure that the technology meets the actual needs of the users. Because if it's socially and culturally not compatible, it will be there, nobody will come and use it, to stay there and waste. The fourth one is empowerment and autonomy. It empowers the people, local capacity, and autonomous in the sense that they're not relying on people from outside. So by focusing on local capacities and resources, appropriate technology empowers communities to innovate and manage their technological solutions. And by so doing, they foster autonomy and reduce reliance on external entities. Any questions, class? All right. So we have looked at the key principles. And those key principles will translate into their key characteristics that it should be affordable. There should be local adaptation, should be sustainable, and it should provide equity. In other words, access to all individuals to have equal access to such resources. So it should be economically viable for the communities that use them with regards to the initial acquisition cost and the running cost over time in the lifespan of that technology or equipment. Technology must be tailored to local circumstances to ensure they meet specific needs and capabilities of the population. Any questions, class, with regards to the characteristics of appropriate technology? All right.
No problem.
So let us look at the importance of appropriate technology in healthcare service provision. It helps to ensure economic development. When you use appropriate technology, it can stimulate local economies by creating jobs. In other words, we get somebody, an electrician, to come and service this autoclave, this centrifuge, this incubator. So this approach supports sustainable economic growth without negative impact, often associated with large-scale industrialization. When I was commanding officer of Navy Hospital, Warri, our laboratory equipment, some of them, even the autoclaves, there's a rating, a lab science technician. When they go back, he comes to repair for us. It's not an electrical hand, it's not a technical, but it's a medical lab technician. But he had the skill to sort out the problem and fix it for us. That is appropriate technology. So we didn't look far. We didn't look far. When I was director of health services at Ignatius Surgery University, we were using somebody from Aba, even though Aba was relatively far, to maintain our medical equipment. We didn't need people from very far places. But I remember that when I was CEO at Navy Hospital, Warri, when our X-ray machine went bad, we had to look for people from Lagos to come and fix it, meaning that we didn't have technicians within the vicinity of Delta State or even Edo State to come and fix it for us, meaning that it was not appropriate. That was it. We had to get somebody from Lagos to put the person in hotel. Fadama comes with a friend of his, they work together as a tag team. So environmental sustainability. By prioritizing environmentally friendly practices and renewable resources, appropriate technology helps to mitigate the adverse effects of development on the environment. Focuses on sustainability in addressing global challenges such as climate change and resource depletion. Social justice is another key importance of use of appropriate technology. In other words, it makes the services available to everybody without disparity. It promotes social equity by addressing the needs of marginalized and low-income communities. It ensures that technological advancement benefits a broader segment of society rather than a privileged few, and by so doing contribute to a more just and equitable world. Cost reduction, that's another important thing. Because we are using local things, cost will be less. Any questions, class? Hello? All right.
None, sir. Very well, Prof.
Improve health outcomes. The whole essence of healthcare provision is preventive care, curative, rehabilitative, and palliative care. So if we have appropriate technology we have employed, it will improve healthcare outcomes, reduce morbidity, mortality, and disability. And the last one is promotion of equity. Provide access so that it will reduce disparities among different groups. So in summary, when we use appropriate technology in healthcare, we are creating and implementing those solutions that are effective, that are sustainable, accessible, particularly in areas where resources are scarce or limited. It looks at or emphasizes the importance of local adoption with community involvement in health technology development and implementation. And it's important in fostering sustainable development by aligning that technological solution with specific needs and contexts of the community needs. And it talks about being very simple, using local resources, compatible culturally and socially, and giving empowerment to communities so that they can achieve their goal of promoting environmental sustainability. So it also enhances quality of life for individuals. So that is the use of appropriate technology. So let us look at some examples that might be appropriate for us, but also might not be appropriate for us, but be appropriate for some other settings where the level of development is higher than our own. Low-cost medical devices, simple and effective medical device that can be produced locally, such as handheld centrifuge or basic diagnostic tools, which are easy to operate and repair. So we can produce prosthesis, we can produce crutches, and so on and so forth. We can produce even hospital beds that are not as sophisticated as the ones they use in US. Telehealth solutions, technology that facilitates remote consultation and health monitoring. Such solutions improve access to healthcare services, especially in rural areas. At least telephone has made it easier for people to call anybody anywhere and complain that I have this health problem. And the person will ask one or two questions. Okay, go and do this test or take this medication. Community health initiatives, programs that utilize local resources and knowledge, such as training community health workers to provide basic healthcare services and education. Electronic health records, digital versions of patient charts that improve interoperability, reduce errors, and provide real-time data to healthcare providers for better care coordination and decision-making. Then remote monitoring system, where you can use sensors and smart home technology to track patients' movement and vital signs at home. And by using such remote monitoring, they can alert caregivers of potential issues like elderly when they fall or changes in health status of people who are being monitored using such devices. These devices are not common in our setting, but there are places they are using. Not that they're not using them, they're using, but they are not very common. Wearable technology, devices like smartwatches, Fitness trackers, smart rings that continuously monitor vital signs, heart rate, oxygen level, sleep pattern, and they send data to smartphones for analysis. Any questions, class? All right.
Nice
Thank you very
presentation,
much.
Prof. Okay. So, please, Prof, I don't know if I should just, say something. Can I go ahead?
Just hold on. Hello, please, I'm having a class. Can you call me by 9? Call me by 9. Yes, I'm hearing you. Student, I'm hearing you.
Okay.
Ask.
Okay, Prof. Okay, Prof. Thank you so much for the opportunity. Your presentation is so nice. It's so relatable too, because I'm a medical lab scientist. I work in a secondary facility. So it's actually very good to know about the appropriate technology thing and everything that it entails. But Prof, on the other hand, even when we are trying to, make do with what we have in our own location, sometimes we have patient relative coming to even, insult us, fight us that we don't have the real tool to work, for their patient and all that. So I don't know, is it out of place if we should, tell them about this technology, that this is actually what is good and okay for you in this location? What do you think, Prof?
The issue is that
Thank you.
the patients or their relatives do not know your challenges, because you give them the impression that you can do everything. They don't know your challenges. So when they come with their problems. And they believe that you are a specialist. You have everything it takes to decipher their problem, provide solutions to them. But when you keep searching for solution to their problem, they get confused. They think that you are wasting time. So that is it. But those who are well educated, if you tell them, sorry, we don't have this, we can't run this test here. We can't run this test here. We have to send you somewhere. Then they know that you are honest with them, that you are handicapped. You don't have the equipment to run that test. Or that, okay, let's look at it. If you have to run full blood count manually, how many samples will you handle in a day? You have to correct, because when they come, sometimes you tell them that we are not taking samples again because you are doing manually.
Seriously.
People are sick, they come to the facility, doctor sees them, or go to the lab. You say we are not taking samples, we have taken enough. Who will accept that? They won't. So it's expected that your carrying capacity is beyond the load you have. Sorry, it's less than the load you have. Therefore, change from manual to hematological analyzer. Hematological analyzer will require a specialized technology, because they use fluid as the medium to run whatever you are doing. And then you cannot buy it everywhere. But the good thing is that you can put in 20 samples, and in 15 minutes or 10 minutes, you can provide results with 16 parameters each.
Absolutely.
True or false?
Yes, Prof, you're correct. That's true.
So that is the thing. But the question is, do we have the technology for that? Probably not, because if that equipment goes bad, you have to bring somebody. In fact, the suppliers, you see the bad aspect of it. These equipment are specialized. So one sole supplier provides in the country. So if that fluid they use to run it is finished, except that person gives you, you cannot run it.
That's true.
The buffer or whatever you call it, you cannot run it.
Yes, buffer.
And if the thing breaks down, you want to bring those people, which is not appropriate technology. But the issue, so if you have problems, don't pretend that you don't have. Tell your patients, refer them. But if you say, we want to keep them and then take the sample and go and do and bring, they will think that you are killing their time. So that is
That's
it.
true, Prof. Oh, thank you. Thank you so much. That's good.
Any other questions? All right,
Okay,
so
good
let's
evening,
go on.
Prof. Good evening, Prof. I just want to ask with relation to the question she also asked. Given that kind of setting where you find yourself in a place where the equipment you have to do what you have to do is not proficient enough for the number you have, and sometimes in a public setting you still have situation where the person that's the scientist or the person who has to do the job then have conflict with management, because management will give situations like all samples should be run within the center, and then the equipment you have to do the job is not enough to meet the demand, and then there becomes you find some level of dissatisfaction because the person who is
Can you
supposed to do
give
the
what
job,
you don't have? Can you
you can't give
give
what you
what you
don't
don't
have,
have?
but it's a
So,
difficult
so
situation. Yes.
I just told management that they should give you that which you need to work with, and that if they don't give you, you cannot work without what you don't have. So that is the
Okay.
thing. Anybody who tells you to do things without giving you the necessary equipment, that person is unfair to you. It's one of the basic principles of organization.
True.
It's one of the basic principles of that. Everybody assigned with responsibility should be provided with the resources to carry out that assignment, without which the person cannot.
Okay.
It's one of the basic principles of organization.
I agree with you, sir.
So if you expect me to run tests when the equipment is not functional, I can't manufacture it. And that is why in the healthcare sector, health workers should run the organization, not administrator who doesn't understand what you are doing. So that is it. You cannot give what you don't have. If they want
Okay.
better services, they should acquire new technology. They should
All
acquire new
right.
technology.
Then on my second concern related with regards to appropriate technology is that given our own environment, will the challenge for appropriate technology be that we are unable to actually provide a technology that we can handle, or is it that there is no commitment towards that direction?
First and foremost, the definition of primary healthcare incorporates appropriate technology. And there is a use of appropriate technology at a pace the country or community can develop.
Develop with, yes,
So
self-determination.
what we call primary healthcare in Nigeria, or sorry, secondary healthcare in Nigeria, could be primary healthcare in the US.
True.
Do you understand?
Yes, sir.
It could be secondary healthcare in US. What they call secondary healthcare might be tertiary healthcare in our own place. Because the healthcare level determines the type of manpower, the type of equipment, and services you are providing. So our own primary healthcare is still rudimentary. Their own has advanced to the level of our secondary healthcare. That is the thing. How many primary health centers have blood transfusion services? We have doctors in primary health centers who can perform laparotomy, but it's not within the scope of the primary health care services. So when they do it like private practice inside public practice, and they take the money and eat it. They don't pass it to government. So even when the skills are there, they will say, at this level, we're not supposed to do this. This should be done at the next level. Meanwhile, it's not at the next level, and it does it. So that is the thing. So it is, if we go and get an equipment that utilizes electricity and we don't have light, what are we going to do? And that is why, to keep vaccines potent, they are provided solar power sources to at the local government level to maintain cold chain. The whole facility might be in darkness, but there is a solar power source to the deep freezer or the ice line refrigerator. So use of solar power is appropriate technology for us, where we need electricity to run some equipment. But where we don't have electricity to run some equipment, then we have a problem. We cannot acquire and use such equipment because they won't work. For us to, we will have to arrange for an alternative source of electricity so that we can run those equipment. All right.
Thank you,
Any
Prof.
other,
Thank you, sir.
any other question? All right. So let us go to another aspect, essential drugs. Essential drugs. What are essential drugs? Essential drugs, by definition, are those drugs that meet the needs of majority of the people and the prevailing health conditions in a particular geographic location. So there are drugs or medications that satisfy the priority health needs of a population, ensuring access to effective and safe treatment for various health conditions. So how do we get these essential drugs? They are acquired with due regard to disease prevalence. Like I said, there are drugs that meet the healthcare needs of majority of people and the prevailing health conditions. So they are selected with due regard to disease prevalence and public health relevance. Another thing to consider in selecting essential drugs is how are they efficacious? In other words, do they do the work they are intended to do? And then, without forgetting the first principle of medical ethics, do no harm. Are they safe? Are they safe? Will they not harm the patients? And then we look at, what about the cost relative to efficacy? So cost effectiveness is another key principle to consider. So one, we're looking at disease prevalence. What is disease pattern in this community? What is the public health relevance of this drug? Is it efficacious? Is it safe to take? And is it cheap relative to the work it's going to do? So that is the characteristic of essential drug. So they are known as essential medicines because they meet important healthcare needs of a population. So WHO definition is that they are medicine that should be available in functioning health system at all times in adequate amounts and in appropriate dosage forms, and their quality should be assured at a price the individuals and community can afford. Any questions with regards to definition of
No,
essential
sir.
drugs? So we cannot be talking about essential drugs because they are not just every drug. We said they are drugs that meet the needs of majority of people and the prevailing health conditions. So for us to have such drugs, we must have a list of the conditions such drugs will treat. So WHO developed the model list of essential medicines. And that list is revised every 2 years to capture new developments and so on and so forth. So the WHO essential model list of essential medicines is a key resource that provides a list of medications considered essential for a basic healthcare system. So that list and the list for children, drugs for children, like I said, they updated every 2 years. The last one was in July 2013, 2023. They included 1,200 recommendations and 591 drugs. So out of that, you can choose whatever you want that will meet your local needs. So the list from WHO, the model list for essential medicine and the model list of essential medicine for children are intended as a guide for countries or regional authorities so that they can either lift it or modify it in accordance with their local priorities and treatment guidelines. So, selection of a limited number of essential medicines are essential, taking into consideration national disease burden and clinical needs that can lead to improved access. Any questions, class, with regards to essential drug list? So the list has two categories of drugs, the core items and the complementary items. The core list presents minimum medicine that are needed for a basic healthcare system. It lists the most efficacious, safe and cost-effective medicines for priority conditions. So under the core items, priority conditions are selected on the basis of current and estimated future public health relevance and potential for safe and cost-effective treatment. So the drugs in that list are the most effective options for key health conditions and can be used with minimal additional healthcare resources. However, for the complementary, they might not be cost-effective, but they are needed. So the complementary list presents essential drugs for priority diseases for which specialized diagnostic or monitoring facilities are needed. Specialized medical care and specialist training are needed. In other words, such items on the complementary list are unlikely to be used in primary health facilities. And even if it's secondary health facilities where such specialist people exist. So that is it. Where you have doubt about those medicines, in case of doubt, medicines may also be listed as complementary on the basis of higher cost. Even if they are common things, but their costs become very high, then they will go into. Recently, cost of drugs went high. Some people will tell you that a drug like Augmentin will be about 15 or 20,000 naira. There's one type of quinolone that was selling for 20-something thousand naira. So such cannot be on the core list. It has to be on the complementary list. Any questions, class? Hello?
Hi.
No, sir.
So what is the importance of essential drugs in healthcare? If people have access to essential drugs, it will aid in the achievement of universal health coverage. Because one of the characteristics is that they are cost effective. In other words, they are cheaper relative to other drugs that can also do the same thing. So let us look at malaria. Artemether lumefantrine combinations are the cheapest. But there are other formulations. Those ones that carry, apart from those ones that are given free, those ones that carry amodiaquine and their group as combination, they are costlier. So that is the thing. So they play a significant role in reducing healthcare costs and improving health outcomes, particularly in low and middle income countries where we spend money out of our pocket for medicines. And such continuous expenditure, out of pocket expenditure, can lead to impoverishment. So when such drugs are available, it helps to ensure that populations can receive necessary treatments for both acute and chronic conditions, and so enhance overall public health. Any questions with regard to importance? So, like we said before, every country, every state, every locality, local authority is free to look at WHO essential drug list and adapt or adopt it for its use. So many countries have developed their own national drug lists, drawing from the WHO essential drug list. So as of now, about 155 countries have created such lists, and these lists are tailored towards their local health needs and priorities. Because we said there are drugs that meet the health needs of the majority of the people and the prevailing health conditions. So the health needs of the people in Canada and their prevailing health condition might be totally different from what it is in Cameroon, from what it is in Ghana. So you look at the list, it's there, but what are the prevailing health conditions in Ghana, in Nigeria? So we draw based on that for our own place. So the establishment of this list is vital for guiding procurement and distribution of medicines, ensuring that health system can respond effectively to the needs of the population. So essential drugs are a fundamental component of any healthcare system globally. They ensure that individuals have access to medications for their health problems. So WHO revises the list every 2 years so that newer ones can come in. Those ones that are better will replace the older ones. Any questions?
Yes.
All right, let's go to another aspect. Let's go to
Hello.
another aspect. Yes.
Thank you, sir, for the explanatory lecture. Okay, my question is about the list of essential drugs, the categorization into core and complementary. Please, if I get it correctly, is it safe to say that they are categorized based on the costs only and nothing else, no other
No,
criteria
it's
is
beyond
involved?
cost. It's beyond cost. There are, you see, essential drugs, like now, let's look at drugs for cancer treatment. Drugs for cancer treatment will not be needed at the primary or secondary care level. But cancer is a common disease. So drugs for such might be there on the list. It is not on the core list because cancer treatment falls into the domain of specialized people. You need an oncologist, you need this, you that, like that. Do you understand? So if we go back to that categorization, the complementary represents essential medicine for priority diseases for which specialized diagnostic or monitoring facilities and or specialist medical care or training are needed. So it's not only cost. The use also is also important. Have I answered you?
Yes, sir. Thank you, sir.
All right. So let's look at another aspect of today's lecture, cold chain management. Cold chain is a requirement for the maintenance of perishable medical items. Even in the general population, cold chains are important because most of the foods we eat require regulated temperature. Besides the drugs, the vaccines we need, foods we need require regulated temperature. We take ice cream, we take frozen foods, we take all manner of things that require specialized temperature to preserve them. So cold chain, just as it's important in the general population, is also important to healthcare service provision. For healthcare service provision, without proper cold chain management, we cannot guarantee the potency of vaccines. Cannot guarantee the potency of vaccine. So cold chain management refers to the comprehensive process of controlling and maintaining the required temperature of perishable products from production through transportation, warehousing, and distribution to the end user. In other words, it's an important aspect of logistics management. It's a critical process in logistic management as it ensures that products are safe and go through effective transportation, or that temperature sensitive items are transported from one point to the other. And what are those temperature sensitive items? Frozen foods, beverages, pharmaceuticals, chemicals, and that is done by maintaining specific temperature conditions throughout the supply chain. If we don't have an effective cold chain management, we cannot guarantee product quality. We cannot guarantee product safety. We cannot guarantee efficacy of products. And what will that lead to? To lead to potential health risks and financial losses. In the context of healthcare, cold chain management system involves storing and transporting vaccines at the recommended temperatures from the point of manufacture to the point of use. We had a big problem. When COVID came, there were so many different types of vaccines. But you know the type they brought for us? The ones they brought for us are the ones that did not need temperatures that are minus 80 or 70 degrees Celsius, or Fahrenheit, Celsius, yes. Because we cannot maintain them at that temperature. Those ones were left. They look for those vaccines that can be stored around -5 to -10, like that, to plus. So that was it. We lack the capacity to maintain those far sub-zero temperatures. So what are the key components of cold chain management? We said we want to maintain them because they are temperature sensitive items, be they food, vaccines, chemicals, as the case may be, they are temperature sensitive. So one of the key components of cold chain management is temperature control. If we don't control the temperature, then they will go bad. Monitoring the correct temperature is key. It involves using temperature control storage facilities, refrigerated trucks, and advanced technology like insulated packaging and temperature monitoring sensors. In other words, when you manufacture, you have to put them at the right temperature and package them such that they will maintain those temperatures. Then you move them to refrigerated trucks, from trucks to cold rooms and whatever. So temperature control is key. Is key. From the time they are produced, when they are packaged, and then transported, and then moved to storage facilities, and then moved to points of distribution and utilization. Temperature control is key. The second component is monitoring and tracking. Real-time monitoring of temperature, humidity, and other environmental factors are very important because they will allow for immediate corrective actions if we notice that there are deviations from what they should be. Certain conditions are prescribed by the manufacturer. So if we don't monitor and track, we won't know when there are deviations. And if we don't know when there are deviations, then we'll run into trouble. So we monitor such that when there are deviations, we take necessary measures to correct those deviations. And then the third component is compliance and documentation. The manufacturers have given you specific conditions to store. So you have to adhere to industry-specific regulations, such as good distribution practices for pharmaceutical products or hazard analysis and critical control point for food. It's essential. I hope people are aware of HACCP in food safety. Hello? I hope you are aware of what
Yes, sir. Yes, sir.
Yes, sir.
Food safety is. Yes. It's all about looking at the food chain from the time raw materials are brought in, processed, cooked, preserved, and then prepared and presented for consumption. So you undertake hazard analysis. Where can this thing be contaminated? Where will contaminants come in? You identify critical control points and ensure that you do what is necessary to monitor those points so that the food will not get contaminated. So proper documentation, including temperature logs and transportation records, are necessary to demonstrate compliance with manufacturers' instructions or industry-specific regulations. Next one is transportation. You cannot use them where they are manufactured. A drug could be manufactured, or vaccines could be manufactured in Canada or in Switzerland, and they will be used in a place like Akbabuyo or Opobo. So you have to transport them, and there will be stopovers like that. And every point of stopover, you have to ensure that you maintain the temperature. So transportation plays a pivotal role in cold chain process. Refrigerated vehicles and containers equipped with temperature control systems are used to move such products safely, ensuring that products are loaded and unloaded swiftly, minimize exposure to ambient temperature. Then we'll talk about sustainability. An environmental concern grows, or as environmental, creating a more sustainable cold chain is becoming increasingly important. So it includes improving energy efficiency in refrigeration. That's why these days they will tell you that this is eco-friendly refrigerator and whatever. In other words, they consume less temperature. Even if the voltage is low, the compressors will peak. So it don't have to be 220 volts. Even at 180, it will work. So energy efficient refrigerator units and reducing food waste due to spoilage. Any questions, class? All right. So what are the challenges in cold chain management? The managers of cold chain face several challenges. Important ones are spoilage. How to prevent spoilage? If they cannot maintain temperature, then there will be problem. So in Nigeria, where we don't have steady power supply, there will be wahala. You might not have power for more than 15 hours. Then you cannot maintain cold chain because that's what they call holdover. When we get there, if the lights off goes, how long will it take for the temperature inside to rise to a certain degree before it becomes unsustainable to keep the things there? So logistic complexity, coordinating the various stages of the cold chain from production to delivery can be complex and require careful planning and execution. Then cost management is another thing. Maintaining a cold chain can be expensive due to the need for specialized equipment and monitoring system. In fact, in Nigeria, people who sell frozen foods, they run generators all the time. And if they are not running there, they have a special arrangement with electricity distribution companies. They place them on special line such that most of the time they are given public power supply and they pay through their nose. That is the thing. The small scale people who buy and retail, they're in big trouble because they cannot run generators. Diesel is very expensive. And if there is no light, then how can you? So effective cold chain management, that is why for a long time, the primary care management system recognized that power supply is key. So they provided solar for most of the cold chain facilities at the level of the local government primary care system, where the MOH and its LIO and CCO are to monitor, and so they have, that is the thing. So effective cold chain management is vital for ensuring the safety and quality of temperature sensitive products and maintaining strict temperature control, monitoring conditions in real time, and adhering to regulatory standards. Businesses can minimize risk and enhance customer satisfaction. You know, several years ago, frozen fish was the cheapest. Now it's as costly as any other thing because the cost of running those cold rooms is unbearable. It's unbearable. As the demand for temperature-sensitive products continues to grow, so does the importance of robust cold chain management practices in the supply chain. Come on. Any questions with regards to challenges? All right. So let us look at the benefits of cold chain management. Safety compliance is critical for the organization that involve cold chain logistic management. Many products, especially pharmaceuticals and vaccines, are required to be stored and transported within strict temperature ranges. They require medical freezers, monitoring to maintain their efficacy and safety. If you fail to do so, then you can incur product loss, costly fines, recall, health risks, and reputational changes or damage to your company. a logistic company, you cannot transport these things, deliver them safely. My products that you transported from Lagos to Abuja, by the time they arrived there, they were not suitable for human consumption anymore. So safety compliance is key. Regulatory considerations. Different industries have unique requirements when it comes to cold chain logistics. So the food industry requires to adhere to regulations that ensure safety and quality of perishable items. So regulatory considerations help businesses meet their regulatory standards and prevent health risks and liability issues. Financial impact. If you cannot maintain cold chain, you will incur losses. So that will be terrible. You are going to lose customers. You are going to lose money. So maintaining product quality can lead to increased customer satisfaction, repeat business, and a positive brand reputation. However, where you are not able to, it will lead to more spoilage. Business can reduce and run financial losses. So what are the best practices in managing cold chains? You need to prepare the product appropriately. You choose the right packaging because the packaging is part of, that's the initial thing. Vaccines are produced, they have to be packaged first before they are transported. So selecting appropriate packaging material and method is vital. So the packaging should not only provide insulation, but also consider factors such as product sensitivity, transit duration, and potential external influences. Monitoring and data analysis. You have to monitor the movement to be sure that the temperature are maintained at the recommended level. So use the temperature sensors and track them so that your products do not go bad. And for you to also achieve best practices, your staff must be trained and retrained. Everyone involved in cold chain management, be it pharmaceutical, biologics, should know the significance of their job and its impact on their end users. So training, refresher training, continuous training are important. And then partnering with reliable logistic providers. Madam, I will call you later. I'm giving you a lecture. So partnering with reliable logistic providers, people who will transport to you. If they are not reliable, then you are going to suffer undue losses. You are going to suffer undue delays. So collaborating with experienced and reliable logistic providers is crucial for successful cold chain management. You have partners that are reputable and they have necessary infrastructure, expertise, and resource that will ensure that your products are handled with utmost care and safety. Any questions, class, with regards to best practices? All right. So let us look at the key players in medical cold chain management. We have those who manufacture the vaccines. We have those who they manufacture, they package, and store before distributors can come. So manufacturers, logistic people, then distributors. After the manufacturers, distributors will take from them and then take to healthcare providers through the state's central cold management system. And from there to local governments, from local governments to facilities where vaccines will be used. So three key players: manufacturers, distributors, Along the distributor, that's where the logistics people will come, transporters. Wholesale and logistics providers are responsible for adhering to the strict temperature guidelines by constantly monitoring the environmental conditions of their warehouses for storage and re-refer or refrigerated trucks for transportation. And we, healthcare providers, we are the users. We are the state cold chain management level, from there to the local government, from local government to the facilities. So they are the receiving end of the chain. So any questions, class? All right. So what are the key elements in medical cold chain management? We are talking about personnel, equipment, and the procedure. Who are the personnel? Those who manage the cold stores at the local government level, sorry, at the state primary healthcare management or central medical store level, where procurement comes in from federal and distributed to the state. They hold it there. And then from there, they use the equipment to hold. From there, they move to the local government. From the local government to the use. So we also need, apart from the personnel who manage the vaccines, their storage and distribution, we also need equipment to store different types of freezers and cold chain equipment to store and transport vaccines and monitor their temperature. And then the last element is procedures in moving from one point to the other till the point of utilization. Ensure correct utilization of equipment and ensure vaccines are stored and transported safely. So in case of personnel, in cases where more than one medical officer is posted to a center, you can designate one as medical officer for routine immunization. But in Nigeria, we have a structure which has appointed local government immunization officer at every local government. And then there's a cold chain officer, CCO, LIO and CCO. So these are the people who handle these things, but they work under the supervision of the MOH. So I know we know all that. So vaccine and cold chain handlers at every we have ice line refrigerator points. The ice line refrigerator points, those are the ones that are the big ones. Designate a senior health worker or nurse or whatever as the vaccine and cold chain handler. But like I said, in Nigeria, routinely, we have LIO and CCO at the local government level. At the state headquarters level, there are other people. So these people are responsible for forecasting, indenting and receiving, as well as storing and distribution of vaccines and logistics, maintaining cold chain equipment and related records at the local government level. Vaccines are supplied to them based on their requisitions. They make logistic arrangement at the state level. They move them to the local government. At the local government, the CCU receives them under the supervision of the MOH and the LIO, and then they store them appropriately. Units, immunization focal persons from each of the wards or health facilities come and pick from them. So that's what happens. So they will require training or updates of knowledge and skills so as to perform their roles effectively. So the Nigerian primary care system, the local government immunization officer, LIO, and the cold chain officer perform these functions at the local government level. So we have now talk about cold chain equipment. What do we use to store and regulate the needed temperatures? So we have both electrical and non-electrical equipment for our vaccines. Electrical equipment are the fridges and the freezers and whatever. The non-electrical equipment are the cold boxes and vaccine carriers and so on and so forth. So for the cold boxes and vaccine carriers, they will require ice packs and whatever. But the other ones, they work with electricity And to maintain that, almost all local government headquarters where those facilities have solar powered refrigerators. So let's go into the details. Class, are we still there? Hello?
Yes, Prof. Yes, Prof.
Yes, we
Yeah,
are.
sir.
Yes,
I know
sir.
that
Yes,
all
Prof.
these things I'm talking, I know you know all of them.
Yes,
There's nothing I'm
yes,
saying that
Huh?
nothing I'm saying that you don't know.
We are
So
following. We are following, sir.
No, now we don't know what some of them, sir.
so I know Allah. So what are the technical specifications of cold chain equipment? We have deep freezers, large deep freezers, ice line regulators large, deep freezer small, ice line refrigerator small, then cold boxes. Those are the non-electrical. The electrical ones are the deep freezers, ice liner, and they are the electrical ones. Then the cold boxes and vaccine carriers are the non-electrical. So they are used to maintain temperatures that range from, for the deep freezer, -15 to -25. Then ice line refrigerators +2 to +8 degrees Celsius. And that's one they use for BCG, OPV, most of the vaccines. The deep freezers are to make ice packs for the non-electric storage facilities, that's the cold boxes. Deep freezer are to make ice pack. Then the other ones are for the vaccines themselves, whether they are large or small ice line refrigerator, they are for vaccines. And they have durations. Like the large one has 135 to 160 liter capacity. The small one has 90 to 105 liter capacity. So that is the thing. And they have holdover time. By holdover time, we are talking about if light goes, how long will it take for the temperature to rise to a point that it will become detrimental to the content? So deep freezers, 43 degrees Celsius for 2 hours, 30 minutes. The ones that store vaccines, about 20 hours minimum. So like that. So these are the things. The cold boxes, when at 43 degrees Celsius for 96 hours minimum. Then, so long as the ice packs are inside. So these are the requirements for holdover time. Any questions? All right.
I have a question.
Yeah, go ahead.
Okay, good evening, Prof. Thank you so much for the lecture. So we're enjoying it and it's very well explained.
All right. So I've explained
Is it
what holdover time is. In the event of power, holdover time
Hello, sir.
for any functional healthy equipment. Yes? You are wasting time to talk now.
Ask. I've been asking, sir. Okay, can't
Go
you hear
ahead.
me?
Ask. I can hear
Okay.
now.
All right, sir. So why is it important to maintain vaccines? You talked about the recommended temperature of +2 to 8 degrees. And then what happens when, maybe what are some of the consequences when there's a break in the vaccine cold chain?
Definitely the vaccine will, if it persists, most of the vaccines have what we call vaccine vial monitor. That vaccine vial monitor will change color through a transition process to a point that you cannot use it again. So if the storage conditions are not ideal, the vaccine vial monitor, besides if you are not monitoring even the temperature of the ice line refrigerator well, the vaccine vial monitor can show that these vaccines are going bad or that they have gone bad. And if it's gone bad, it means that it's no more potent. So if you give, whoever receives will not be protected against that disease for which you are giving. Have I answered you?
Mm-hmm. Yes. Yes, sir.
Hello?
But
all right.
Yes, I get you, sir.
Let me, oh, listen. You want to buy ice cream. If you want to buy ice cream, you put it in your fridge and light goes. And if it melts, it just turns to be pap now, akamu. So will you say you're taking ice cream? Hello?
No.
You
No,
are
no.
not taking ice cream. So that's what will happen. Once it loses potency, the vaccine monitor will show it. And if you take it, you are not protected. Not only are you not protected, the cost of manufacturing that vaccine, transporting it from wherever it was manufactured to Nigeria or your country to your location is wasted. It's wasted. It shows
Prof,
that
are there any health
somebody
consequences? Sir?
Eh?
Are there any
Yes.
health consequences for giving somebody an expired vaccine or a less
But
potent
did you
vaccine?
hear what I'm saying? That it will not protect you. A vaccine is to protect against the occurrence of a communicable disease. And if you take a vaccine and it does not protect, it means that you are susceptible to the disease. Is that not strong enough health consequence? It's like saying you are sick, they give you treatment for that disease, and the disease is not going. Won't your condition get worse? Hello?
Mm-hmm. Yes, but I felt maybe the vaccine will introduce some harmful effects in the body. Is it possible that it will cause something negative, given that it's an expired vaccine?
It depends. It depends. It depends on what the manufacturer says.
Okay.
Depends on what the manufacturer says. It may not be harmful, but one thing is the protection is not guaranteed.
Yeah.
It may not be harmful. It may be harmful. But the thing that is certain is that it might not protect you.
Okay.
Any other question? So the holdover time is the time taken for a cold chain equipment. If there is no more power supply to it, to raise the inside cabinet temperature from its cutoff temperature to the maximum temperature limit of its recommended range. For ice line refrigerator, if the temperature is 4 degrees Celsius, then the holdover time will be time taken to reach 8 degrees Celsius from 4 degrees Celsius, which will be the holdover time for that ice line refrigerator. Now, all of them cannot rise at the same time. There are factors that influence the holdover time. If the environment, like in River State, for the last, up till last week, from July also till last week, the environment was too cold. So the ambient temperature is important. If the ambient temperature is low, like in winter in US, in Europe and America, in the winter period, the ambient temperature will be much lower. So it will take a longer time for that rise to take place. But in winter, in summer, it will take a shorter time for that rise to take place. In the temperate and tropical and subtropical region, it will take a shorter time relative to the temperate region to do that. Then, how often do you open the fridge? How often? That's why mothers will always tell their children, stop opening the fridge or there's no light. The same thing applies. If the Iceland refrigerator does not have light, the more often you open the thing, the more you introduce heat to it. So, and then the quantity of vaccine inside with adequate space between the container is also important. So another one is the condition of ice pack lining for those ones that are non-electrical. Frozen, partially frozen, or melted are also important. Any questions, class, concerning holdover time?
Hello, sir. I have one.
Yes.
Okay. Thank you for the wonderful lecture. Mine is just a little clarification. The slide says, with regards to health system, the co-chair management talks
Hold
about
on.
vaccine only.
Wait first. I started generally with regard to management of cold chain, irrespective of medical or non-medical, including supermarkets, cold stores where they sell frozen food and whatever. We started from general, then we came to specific, which is our own area of primary constituency. So that is what we are discussing now. Hello?
Okay, my question with regard, yes, I'm here, sir. My own question is with regards to other aspects of healthcare, like the human specimen, the blood, the urine, the sputum samples. Does it also involve?
They are not part of the cold chain management context we are talking. The blood samples you collect, no, that's not part of it. Are you hearing me? We are talking about things that you take and store for months and distribute small. So we're not talking about you take blood sample and put inside fridge, and then when you are using and whatever. You're not supposed to keep them for too long. So it doesn't cover the use of biological samples in the laboratory for diagnostic purposes or research purposes. All right. Have I answered you? Hello? Is it gone?
Yes, sir. That's
Is anybody hearing me?
It's okay now.
Yes, sir. I can hear you, sir.
Yes, Prof. We can hear
All right.
you. We can hear you, sir.
All right. So Iceland refrigerator point and cold chain point. So let's not go into all these details. When you get the notes, you read them. So now there are do's and don'ts, because if you open them often, if you don't keep to the regulations, you cannot guarantee the quality of the vaccines in the Iceland refrigerators or the deep freezers or cold boxes, as the case may be. So the do's are that you keep all vaccines, including those returned under open via policy, in baskets supplied along with this Iceland refrigerator. You don't put them on the floor of the Iceland refrigerator. Put them in baskets. Then diluents are not supposed to be frozen. They're supposed to be stored at +2 to +8. But if they are frozen, then you can't use them. Then you leave space in between the vaccine boxes in the Iceland refrigerators. Then you place a thermometer in the basket in between the vaccine so that you can monitor the core temperature there. Keep freezer sensitive vaccines at the top of the basket. Then keep heat sensitive vaccines at the bottom of the basket. In other words, in as much as you are putting different things inside the same Iceland refrigerator, those ones that are heat sensitive should be at the bottom. Those ones that are freezer sensitive, freeze sensitive, that should be at the top. That is the thing. So, and You arrange vaccines as per their expiry date. Early expiry should be above, and then the late expiry should be below. These are the do's. The don'ts. You don't store any other drug or non-routine immunization vaccines in the ice line refrigerator. Open it frequently. Do not keep food or drinks there, because that's not for it. Attempt to be taking your food or whatever you can destroy those things. Do not keep vaccines which have expired or have crossed the discard point of vaccine via monitor. Do not disturb the thermostat setting frequently, and do not place heavy weight on the refrigerator. And you should not store excess stock of vaccines, that is more than what is required. So these are the things for the ice line refrigerator. We need the same thing for deep freezers. Use deep freezer only for preparation of ice packs. Use them to store OPV at district level. Then keep frozen ice packs in the vaccine storing deep freezer to increase the holding time. You do not keep any vaccines in the deep freezer at sub-district level. In other words, at the facility level. Never keep diluents in the deep freezer because to freeze it, to form block. At the district level, do not use the same deep freezer for simultaneous storing vaccines and preparing ice pack. These are the things. And they are there for all other types, including the cold boxes and so on and so forth. So, ladies and gentlemen, let's go to the last scope item. Let's go to the last scope item, which is medicalization of food. Medicalization of food, that means we are making food become medicine. Medicalization of food. You turn food to become medicine. It's a social concept or sociological concept that looked at food as a medical terminology or as an intervention. Intervention means something done to ameliorate a situation. So it is the process by which non-human conditions or non-medical human conditions and problems are seen as and treated as medical problems, usually in terms of illness or disorder. So this concept rose in medical science because of new evidence or hypotheses about conditions by changing social attitudes or economic considerations, or by development of new medications or treatments, where we take food as if we are taking medicine. And then we are taking food at the back of our mind. We are looking at the health implications, the health benefits, and the potential danger it will bring about. So the rise of medical science, expansion of the pharmaceutical and food industries, escalating worries over diet-related diseases, and growing anxiety over infant and childhood development have added so much impetus to the process that is called medicalization. So food companies are careful not to market products as if they are drugs. While food companies are careful not to market products as if they are drugs, there is increasing trend to market products that they have health claims, blurring the distinction between what is food and what is medicine. Most times, they'll say they have nutritional supplements, even when you are having those things in your food. They say buy them, they will add to whatever you need, keep health. So medicalization transformed the act of eating from a pleasurable and social act into medical and health beneficial acts. In other words, we eat food to enjoy food. we eat food to enjoy it. We eat food because community requires it. But now we are turning it to be as if we are eating because of health reasons, because of benefits, health benefits we are going to get out of it. So it is the process of transforming food eating and feeding practices from the traditional, cultural, social, and symbolic acts into more medical or dietetic ones, often driven by biomedical logic, health claims, and professional medical discourse. We are seeing food more like treatment for health conditions. Taking food as if we are preventing some diseases or we are ameliorating the situation of certain health problems. So medicalization often involves reducing food into its nutritional components. We are looking at macro and micronutrients within the food. Instead of just eating food, we look at, is it protein rich? Is it carbohydrate rich? Is it rich in minerals and vitamins? Thus promoting specialized products for specific health conditions and increasingly portraying food as a means of remedy or preventing illness rather than solely for sustenance or social enjoyment. Class, are you following me?
Yes, sir.
Hello?
Yes,
sir.
yes, Prof.
Sir.
Yes, sir.
So what are
Yes,
the
bro.
key aspects
Yes,
of
sir.
medicalization of food? The key aspects are that there is a shift from culture of eating for enjoyment and social reasons to eating for medicine. Eating habits and food choices are increasingly viewed through the medical lens, often neglecting their social, symbolic, and adaptive functions in different cultures. The focus now is on nutrition and disease, not enjoyment. Food is reduced to its scientifically quantifiable components, that is macro and micronutrients, that are needed to manage specific diseases or achieve dietary normality. Instead of eat food and enjoy. I'm enjoying this meat too. I'm enjoying this pomo, this cow tongue, or this fufu. That is not, we are looking at it from the nutritional point of view, what it does to you, not for enjoyment. The medical and nutritional authority is another aspect. Doctors and nutrition professionals, they become the primary authority on how to eat. And by so doing, they are changing or displacing the traditional knowledge and practices attendant with feeding or food. They say, do not take this in your food. Take this in your food. Reduce this. Things that will make you enjoy your food. They're saying, don't take them. Don't take them. You eat food. Say, don't put salt. Salt. You're eating food. You're not enjoying it. What will make you to enjoy, you are removing it because they are medicalizing the food. Marketing and advertising. Advertisement for food products increasingly emphasize nutrition and health claims, thereby positioning food as medicine for the body. Then, in addition to all this, there are specialized food specially made for specific groups of people who have certain health problems. Food for diabetics, food for kidney disease, infant formula, and so on and so forth. So the development and promotion of specialized food products for managing health conditions like infant formula, products for diabetes or kidney disease, is a direct manifestation of food medicalization. Are you there, class?
Yes, Prof.
Yes, sir.
So what are the ethical concerns about food medicalization? Ethical concerns. We eat food for enjoyment. We eat food as our culture dictates. Culturally, there are things we eat in a particular way. Either they are half cooked or they are cooked overcooked, as the case may be. But with medicalization, they will tell you that as you are cooking your food, just put the vegetable in the pot. 3 minutes, you remove it so that you don't denature the vegetable. And that is not what you are used to culturally. So medicalization can lead to reduced culturally significant practices to medical ends. It will mask social and environmental determinants of health. Because when they are medicalizing food, it means that those social and cultural determinants of health, environmental, are going to be masked. Then burdening individuals with responsibility beyond their control. Most of these foods they are recommending, eat a lot of fruits, a lot of vegetables. Fruits are very expensive. Fruits are very expensive. Some vegetables are also very expensive. So now they are recommending them for you because you are diabetic. You should eat volumetrics or whatever. So they become heavy burden on you. And then increasing medical surveillance of eating habits. You look at what people eat, whether they are healthy or unhealthy. So there is always the consciousness of what people eat or don't eat. Any questions, class? All right. Then there is the broader social influence. Medicalization of food extends beyond direct patient-physician interaction to public health campaigns. The media portrays and popular culture, shaping how people understand and interact with food. They're not seeing food as that which is needed to exist, to enjoy, to socialize by way of party.
Hello?
We can't hear you, sir.
Seems Prof was logged out. Maybe network.
Hello? We can't hear.
It's network everywhere.
Okay.
Abis that time go limo. It has got one.
Prof, you are muted. We can't hear you.
Network disappeared. We started by saying that medicines, vaccines, and technologies are one of the 6 building blocks of any health system, and that they are necessary for the performance of any health system.
Please, you can see your slide.
We have finished the lecture now. What are you looking for slide? Have we not finished the lecture?
We didn't know, Prof.
The lecture has ended now. Didn't you see conclusion?
Sir, we didn't hear you.
We didn't see
We
it,
didn't
sir.
see the conclusion, sir.
We didn't see it.
We did not.
see
Now you are seeing. Are you seeing my screen?
No.
You are
No,
not
your
seeing
slide
my
has not
screen?
come up.
No, sir, we
No,
can't
sir,
see
we are not
this.
seeing it.
We have seen it now.
We have seen it, sir.
Conclusion,
We have
no.
seen it.
Sir, for about 10 minutes, we didn't hear you.
No,
Sir, we didn't get
it was not up to 10 minutes.
but, well, okay, maybe 20 minutes.
It's not true.
Is it not 1 hour? You didn't hear me for 1 hour now. Is it only 20 minutes? Did you not see this slide?
Bro.
We saw it, sir. We
Did
saw
you
it.
not see this slide?
Just for 5 minutes.
We
Don't
saw
mind
it.
them.
We
Did
saw
you not
this
see
one.
this slide, this particular slide?
Okay.
We saw it. Yes, that
We
was
saw
the
it.
last.
We saw this one, sir. That's what we saw
Now,
before
from
the
there, I said, I went to conclusion now, and I was
Eh?
concluding, I was
So
summarizing.
we are on point. We are on point.
I said that medical products, vaccines, and technologies are one of the 6 building blocks of WHO building blocks for any health system. And that each of the 6, that is service delivery, health workforce, health information management, healthcare financing, medical products and technologies, vaccines and leadership and governance are all important in regulating the activities of drugs, vaccines, and technologies. That without each of them, that building block cannot function. You need them to service. You need medicines, vaccines, and technology to deliver healthcare services. They are needed to be used by the health workforce, and they are needed to provide data for decision making, and money is needed to procure them and use. And then the regulatory framework, leadership are needed for guiding which one is appropriate, which one should be used, and which one should not be used. So that is it. So they are very important. Now we move from there to talk about appropriate technology. That appropriate technology is needed for us to function. Appropriate technology is technology that we can easily manage, is locally available, and is accessible. And we now give examples of appropriate technology in healthcare delivery. Then we talked about essential drugs. That essential drugs are the drugs that meet the needs of majority of the people and the prevailing health conditions. And their selection is based on WHO essential drug list. And that there are 2 lists. Essential drugs for adults and the ones for children. And these lists are revised every 2 years. The list has 2 components, the core and the complementary. And that the core are the ones for everyday use. The complementary are either more expensive or they require specialists to use them. Then we moved on to cold chain management. From cold chain management, we went to medicalization of food. So I want to thank you for your time. So what do you, we have one more lecture. Are you hearing me? We have
Yes,
one
sir.
more
can hear you,
lecture.
sir.
So possible.
Yes,
Is it
sir.
possible we fix it for Friday if you don't have
Okay,
anything?
okay. Tomorrow will be fine,
We have
sir.
one more lecture.
Tomorrow
I
is
say, is it possible we fix it for Friday?
sir, that would be
Friday.
better.
Tomorrow, sir.
Rep.
Tomorrow.
Ikena.
Yes, sir.
Friday.
I'm with you,
I
sir.
won't be available tomorrow. I won't be
Okay.
available tomorrow.
Friday is fine. Friday is fine.
So we can arrange for Friday. No
Let's
problem, sir.
All right. Thank you
Thank you.
very much. I hope I didn't bore you with my lecture.
Not at all, sir. Very interesting, sir. Thank you, sir, for the lecture. It was
Thank you.
interesting, sir.
Yes, sir. So
Thank
we
you,
enjoy
sir.
our
Very
lecture.
Thank you, sir, for
interesting.
the
Good
lecture.
evening, Prof.
It was very interesting and relatable. Thank you, sir.
Very,
Thank you,
very.
You're
sir.
welcome.
Thank you, sir.
Interesting.
Good
We
night,
were not
sir.
It was very,
asking,
very
we were not,
interesting.
Good night, Prof.
we didn't ask
Very
questions
interesting,
because
sir.
we understood.
Thank you very much for your understanding.
Thank you, sir.
Thank you, sir.
Good
Good
night.
night, sir. Have a good night.
Good night, sir.
Good night,
Good night.
Prof, sir. Thank you so much, sir.
Good
Good
night,
night, sir.
sir.
Dr.
Good night.
Ebelema,
Thank you so much, sir.
Ebelema,
Good night.
Sir,
Thank you very
Ebelema, what
much,
is
sir.
your surname?
Good night.
I said thank you for the lecture, Prof, sir.
No, yeah, thank you very much. There's one Ebelema. What is your surname?
My surname,
Idodo.
Idodo.
Ebelema,
Idodo.
Idodo.
Yes, please, sir.
It's all right. You married somebody from that Idodo
Delta
place.
State. Yes, sir.
All right.
But
Thank
I'm
you.
Bonnie.
Because this is my
I'm
village
Bonnie.
name.
So are you from Bonnie?
That's what,
Wow.
I'm a German from River State. So whether na Bonnie I be you, Okrika, Calabari,
Hey,
anything,
Prof, I'll be
my
your
village.
sister.
All right.
Pleasure,
Good
sir.
night.
Good night,
Good
sir.
night,
Good
sir.
night.
Good night, sir.
Sir.
And when are you coming to Bayelsa?
Best I can